Hello, my name is Rebecca Seagraves. I am a pelvic floor physio or physical therapist and founder of the Pelvic Health Network. It's an organization that I founded that is committed to providing people with information, support, and therapy within the first 24 hours after birth and pelvic surgery. I have the honor of speaking with Kim Vopni, who is known as the Vagina Coach. Kim is a personal trainer, pelvic health coach, and soon to be menopause support practitioner. She trains professionals through a core confidence specialist certification and coaches women on pelvic floor exercises, lifestyle management, and recovery protocols that they can start before undergoing pelvic surgery. Kim is the author of Your Pelvic Floor, a practical guide to solving your most intimate problems, which is available on Amazon. And she is the creator of the Buff Muff app, which includes an exercise library of whole body workouts, meal plans, weekly live coaching calls with her, and access to her community of experts who are passionate about pelvic health. Kim, thank you so much for joining me tonight.
You're welcome. Thank you so much for having me and for the lovely introduction.
Excellent. Well, let's get started. I really am excited about this topic. I discussed with you a little bit offline my passion about pelvic surgery and more really about informing people early on. I started my career, and we discussed this a little bit, being used to the idea that I was to treat prolapse, incontinence, pelvic pain reactively as a pelvic floor physio. And you understand that all too well from what I read in your book, the information that you're sharing with women. You're very, very much a proactive, preventative a care coach. And I want to talk to you a little bit more about your journey. Tell me a little bit how you got started doing this.
Mm-hmm. Yeah, well, really, it was prevention that got me here and has really played a role in kind of the evolution of my business and also my own pelvic health. And it started really with sixth grade. I saw a childbirth video and I thought, there's no way in heck I'm going to be doing that. And it planted a bit of a seed with regards to, a bit of fear, a bit of fascination. And I went home and asked my mom questions, and she was an OR nurse. She was very open with body talk, body positivity really at the time. And so that was, my first introduction was, nope, not going to do it, but still curious. And then, many years later, I watched my sister-in-law give birth. She used a midwife. She was in a sideline birth position, which I'd never seen before. And it sort of opened my eyes to something different than I had seen in that video or had seen portrayed in media. And then the next year I decided I did want to start a family. I was pregnant using midwives. They recommended a product to me called the Epino. And the Epino stands for no episiotomy. And it's a biofeedback device that helps people connect with their pelvic floor to do Kegel exercises to contract and relax the muscles, but also to do some perineal massage. And so the principles behind the product made sense to me. I purchased one, had a great experience. I know that it played a role in my birth outcomes. And I felt like, why is it that nobody else is talking about this? And why aren't we looking at pregnancy as an event we should really be training for, kind of like we train for a marathon or triathlon? I mean, arguably birth is like 4 or 5 marathons put together. So it really deserves a lot more attention from a preparation perspective. So that's the companies in Germany. I contacted them. They allowed me to become a distributor in Canada, and it was supposed to just be a side thing. And a few years of it being a side thing then turned into full-time after the birth of not long after the birth of my second. So that's how it started. I had an e-commerce store selling all sorts of pelvic health products. I then had pelvic floor physical therapists referring to me, and I had never heard of pelvic floor physical therapy before. So that was another now option. I was thinking, why is it that we are not all seeing a pelvic floor physical therapist during and after our pregnancies? I formed a second business called Bellies Inc. with 2 other women, one of which is a pelvic health physical therapist. The other one is a trainer like myself. And we were looking at postpartum recoveries and saying, okay, we're promoting this work about prevention, but we also now have to we need to prepare for recovery, and we need to optimize what people are currently doing, because it's kind of a race to the gym at 2 weeks postpartum to post your selfie and not look pregnant as fast as possible, which we felt was contributing to this, what we were seeing, an increase in kind of core and pelvic floor challenges. So very much early on was focused on pregnancy and early postpartum. Then we as business partners were going through our own life stages. So perimenopause, two of us are now post menopause, and we were recognizing that this conversation is really throughout all the life stages. And then we also were dealing with our own prolapse or our own incontinence or our own pelvic health journeys as well. Myself having a stage 2 uterine prolapse and a rectocele along the way. And then eventually, after 9 years of living with that, coming to the decision to have surgery, and then recognizing that. So I booked and canceled that surgery twice because I felt like a hypocrite. I felt shame. I felt embarrassment because of what I do mainly. And then in the end, I said, this is an option for people, and it is a good option for some people. But just like pregnancy and postpartum, there is no information about preparing for or recovering from. I would say even less available than there is from a postpartum perspective. So that's kind of now bringing me full circle in a way. And that's how it started. And that's where I am now. So I've been doing this for 18 years.
18 years. And I'll be transparent. I have been a pelvic health therapist for 7. And so I was a personal trainer before that. And, my journey, honestly, was not being exposed to childbirth videos. And I know that there's a culture, I didn't even think to introduce just the cultural differences of being in the United States, and that was the Eastern United States, New Jersey, and you're in Canada.
Mm-hmm.
And so perhaps, that might play into it, but we just did not talk about even menstrual cramps in school. And so I had terrible cramps. I had abnormal bleeding all throughout, childhood, adolescence, teenage years. I would miss school at least once a month because of it. And so when I became a pelvic health therapist, Kim, I kid you not, it was almost like, too taboo to talk about, all throughout these stages. And so I would see women who just waited years, were just in pain for years before they even thought to really talk to their doctor, to really search for a referral, and then come to me. Yeah. And so I've been spending so much of the past, few years in trying to break down barriers to information, starting very, very young where I was, and then starting really just in circles of even my own community. I'm trying to look for, and this is how I came across you. I'm looking for people who are coaches or personal trainers who have this information from lived experience. 18 years you've been doing this. And I want to know how you or what you, coach women on before these surgeries, so that really their experience does not have to be waiting so long to see someone like me. What are the things that you want them to know before going to into any type of surgery, hysterectomy, cesarean section, pelvic organ prolapse surgery, you name it? What do you cover?
Yeah, I think really one of the biggest things that I advise people is to understand the root cause of what led them to where they are, because sometimes left unattended, that root cause, if not addressed, will potentially interfere with the surgery outcome, could wind people up where they were before, or potentially even worse. So constipation is a really, really big one. There are so many people who struggle with constipation that can be a reason why prolapse has developed or exacerbated. And if that is not addressed prior to surgery, that will make their recovery much more difficult. And then again, more likely that they are going to have a recurrence. So that's one root cause. The other, I would say, from a hysterectomy perspective, hormonal imbalance, which can then contribute to and lead to things like adenomyosis, so abnormal thickening of the uterine lining, heavy bleeding, fibroids even. And not to say we can always eliminate that, but sometimes we can with diet and lifestyle changes, with supplements, maybe Chinese medicine. Like there's all sorts of other, I always want people to build a healthcare team. I think that we need more people advising us than just a medical doctor. And no disrespect, we absolutely need medical providers on our team, but I think we deserve and can become more informed when we have other opinions and complementary approaches. So I really like to get to root cause. And I know that medical doctors are not trained. That's not their area of expertise. But functional medicine doctors, naturopathic medicine doctors, Chinese medicine doctors, functional dietitians, like all of those people can help determine what has maybe led to that heavy bleeding or the fibroids or the adenomyosis, potentially endometriosis as well. But and can we address that and potentially get the symptoms under control where it's now no longer, the surgery is no longer needed. But in the process, even if surgery is still chosen or opted for, the body is now probably going to be in a better state, reducing inflammation levels, reducing stress and cortisol, so that the outcomes and the state of the body is in a better position to undergo that kind of planned trauma, if we will. So root causes and also conservative approaches, conservative management approaches. A lot of people don't know about pelvic floor physical therapy. They don't know about pessaries. They don't know about laser therapies. There's so many other things available now that many people don't know of. And I would want to make sure that people have at least been informed of those options so they can make an informed choice whether they try those or whether they opt to go forward for surgery right away. So that would be my number one thing. Don't leave those things unattended. And that was a big thing for me, where in my 40s, I had 2 young kids. I was running these 2 businesses. I started having very heavy menstrual periods. I had weird skin rashes. I had heart palpitations. I had high cholesterol, high blood pressure, and constipation out of the blue. I had never had a problem with constipation ever in my life before, and all of a sudden this happened. So looking back with the lens I have now and the education I have around perimenopause and menopause, it's very obvious what was happening. The other piece, though, that was kind of hidden in there that is also very commonly experienced in women is autoimmune conditions. For me, it was an autoimmune thyroid condition, which was really contributing to that development of that constipation. So that was exacerbating an existing very small rectocele that I had. And now that it got to the point where it was a stage 2, it was really, it's very symptomatic. It was altering my quality of life. So then I was starting to consider surgery. And the very first time I went to visit a surgeon, I was still dealing with constipation, and I had very heavy bleeding, like murder scene periods, I also always say. And so part of me was thinking, how can I book a surgery? Because what if I'm bleeding very heavily on that day? Or what if I start to bleed very heavily in my post-op recovery? How will I know if it's my period or if it's, so I knew I needed to get that under control first. And so I canceled my initial booked surgery. I started to get that under control, but constipation was still kind of lingering. So I booked a second booking that I had. And it wasn't until 4 years after the first time that I saw the physician that I finally did go ahead, which is now coming up 2 years, almost 2 years to the day that I went for surgery. It was December. I was trying to look back. It was either December 5th or 6th. I think it was 6th. And had I not addressed that constipation and the heavy bleeding ahead of time, I feel like I wouldn't have had the outcome that I did. I wouldn't have experienced the kind of liberation that I experience now, because that still would have been hanging over me. So that would be my first number one thing to do.
That is absolutely astonishing, first of all, that, you had to really guide your own information and education.
Mm-hmm.
And it really shouldn't be so astonishing, because here we are, and these surgeries are being performed on women quite routinely without them having information of things that they can do beforehand, even in terms of behavioral change. But you took 4 years. I have to repeat that, 4 years before actually then going forward with the surgery to educate yourself. Who does that?
Well, I think part of it was also because this is my profession, and I know how damaging constipation is to the pelvic floor, and I am a root cause believer. So I knew that there was something other than just hormone imbalance, and I just have to kind of put up with it because of like from my heavy bleeding. So I just, that's just my nature, I guess. I want to know why this is happening and what can I do about it. Meanwhile, I still was kind of in those desperate times where I just like, forget it. I'm just going to go ahead with the surgery. It'll just make everything better. And then I'll be able to address my constipation. Then I'll be able to address my heavy bleeding better. But every time I would just have this pit in my stomach, and I said, no, I can't do this because I haven't gone deep enough yet. So I know not everybody's like that. I encourage people to become informed so they know what questions to ask, because there's another tip I have is to understand your procedure, because we will finally seek help. Sometimes after years of suffering, we see our family physician, they refer us on to the specialist. And that can sometimes take months or years, depending on where you live in the world, to be able to get in to see that specialist. And when you do, you're not even really, you just know you have these symptoms. You may have heard a term prolapse, or you may have heard, fibroids, or you need to have a hysterectomy. You might have heard those, and you are just like, okay, here's the date and here's what you need to do. Here's the medication you need to purchase ahead of time. So we're given kind of this stuff that we need to know, but there's a whole bunch of other information that I think is missing that would help people better understand their procedure, better prepare their body for it, and also know what to expect and what to do in the post-op recovery phase. I get questions all the time from people. I just had surgery and I have no idea, how do I recover? When can I go back to fitness? What's safe or not safe for me to do? Those guidelines are simply not provided, or they're very loose, like gentle walks and light yoga movement is so and don't lift anything heavy. That's the biggest one. And so then people have this belief that they can't ever go back to what they used to do before, which I also think is a detriment to pelvic health as well. So yeah, so getting informed is really important.
I agree. I am a big proponent that information should start really within the first 24 hours of surgery. Not everyone agrees with that, because we don't have pelvic health therapists necessarily in the hospital that's available to women after these major procedures. So it's especially after a C-section. I talk about that a lot. It's an open abdominal surgery. And yet, and at least in the United States, we're seeing people routinely after knee and hip replacement twice a day, Kim. They get a physical and occupational therapy visit, usually by both, twice a day. And not to say that knee and hip replacements are not major surgeries in and of themselves. These individuals have trouble getting out of bed. They have trouble going up and down stairs. But when you compare their activity level and what they're expected to do to someone who's had a major open abdominal surgery like a C-section, and we're really comparing a surgery that's affected every system in the body. Right? Your digestive system, your respiratory system, the ability to even have a bowel movement after a C-section is just a whole marathon in of itself. Right? And so getting in and out of bed, I've noticed that more individuals are not educated on how to simply get out of bed while they're in the hospital. And they're in these positions that basically fold them at their incision. They're not even guided on lying down flat, for at least the first 12 hours after these major surgeries. And so they develop what I've been able to quite easily see was a type of tire around their belly. We call it the cesarean pooch. That tire and all that pressure does not help them necessarily recover. It actually probably exacerbates later on a prolapse or chronic pelvic pain and all of that. And so in that time period after a major surgery where I'd want to see them, right, not at 3 months, not even at 6 weeks, but really within the first few days, they're not given a referral. They're not given information. And so I'm really interested in this next portion of our talk is, one, how do people find you? And when they find you, how do they differentiate you between a coach and a pelvic health therapist who, we're talking about they should see, but they're not given access to. Accessibility to pelvic health therapy is, or physiotherapy, is really a big barrier. So how do they
Yeah.
differentiate you from them?
Yeah, not everybody does. There's even a lot of pelvic health professionals who believe that I'm a physio. I think because I use a lot of the language that I had a business partner who was a pelvic floor physio. I've worked with that population for so long that I share a lot of the same terms. So people think that I am. I'm not. I'm a personal trainer. I am a fitness professional, and I believe in a collaborative approach with pelvic floor physical therapy and fitness professionals. So the way that I present, well, people find me mainly through social media and word of mouth, and sometimes Google searching. And they when they come to me, they're sometimes uncertain about what I do versus a pelvic floor physical therapist. And the way that I present it is, I believe and refer everybody, I believe everybody should see a pelvic floor physical therapist, and they will handle the internal evaluation and treatment. From a surgical perspective, it could be a scar tissue management is a big piece post-operatively, and also helping prepare the pelvic floor prior to the surgery. And where I come in is I help with the movement piece. So the therapists are really kind of the hands-on people, and they are familiar with exercise, but they don't necessarily monitor exercise. And I help kind of with that monitoring, but also help exploring other movements that maybe not even the pelvic floor physical therapists are as aware of. Sometimes different techniques that the pelvic floor physical therapist may not, such as hypopressives. So we're a collaborative team. As I mentioned, I believe in a healthcare team. So I'm one member on that team that works collaboratively with the other individuals. And I want to provide as much information as possible and as much inspiration through movement practices, whether it's the free content on my social media platforms or through one of my paid programs. And I also do coaching because some people just want to talk to somebody. They're with the wait times that people have, with the uncertainty of, what they should ask. And then once you get in, you have a short window of time, and you're overwhelmed because you don't know what to ask, and you're being thrown all these terms and you're not quite sure what's happening. So they just want somebody to help them decipher the information, help them know ahead of time what they should be asking for or about. And that can alleviate so much stress for people. So the online coaching is a really, I would say it's one of the more valuable. I don't mean that from me. I mean that people take more value away from that because they're just speaking to a human and somebody who's been there as well, which helps kind of calm their fears down as well.
I think that's so important. I really struggled as a pelvic health, therapist with a 35-day wait list. How can anyone be helped by that? And then, also time constraints. When I worked in a large hospital system, if I had 45 minutes, that was a lucky, time. And by that time, people are just, getting warm, to the fact that, okay, I'm in a safe space. I can talk about these things. Wait, and now you want to do an internal exam? Like we just met. Yeah. And so really, honestly, it's just been a delight to even read how easy your book is, your pelvic floor practical guide to solving your most intimate problems, how easy of a read that is, right? And my big thing is, if we're not explaining things to people at a level that they can understand, we're not connecting with them. We're not, it's actually a disservice.
Yeah.
Right?
And I thank you for that. I appreciate that's how it's read, because that's really what the intention was. I want this to be information that is digestible and understandable and people can put into action. And I also want people to know that they're not alone. So there's an element of storytelling in the book as well, with some case studies. And that's another part of where I strive to, like, through my business, have a sense of community where people know that they're not alone and they know that they can connect with me, but potentially others. So the Buff Muff app you mentioned, I do a challenge, and there's 50 to 100 people each month that come in there, and when they can see the struggles that other people have, the wins that other people have, there's an element of motivation, but an understanding of I'm not the only one who's dealing with this. I have felt alone in this for so many years, and they see hope and they see opportunity. And I think that's a really important piece of the healing that people go through as well.
Excellent. Great segue. Buff Muff app, you have meal plans on there. Now, do you have meal plans that also help people, say if they're going in for endometriosis surgery? I'm not sure how much you know about that procedure, but just observing one, they're almost in some cases they're in like a 45-degree angle back. And so I treated a young lady after endometriosis surgery, which, is different for everyone because it depends on, where they're tunneling through to remove, to basically do like a small exploratory surgery, if you will. So there's a lot of tunneling. And so there's a lot of fluid that collects in the pelvis. And so I treated someone after, she had an abscess that formed. And it was extremely painful. She had to get a drain to basically drain that fluid from, the area around her tailbone. And so, just kind of like understanding that there's a component of the surgery that as pelvic health therapists, we are waiting too long to see these individuals after. I was able to see her within 48 hours of her surgery, but it was because she had complications. That's not the norm still in the United States. So I want to go through a little bit about, your app and what people might be able to find on there, because I feel like had this woman known about even the surgery position, about maybe how she could heal to not be in that position where the fluid could have collected and then become infected, and then she had a drain, all of that probably could have been avoided with information that we give to people after the most common of procedures on their shoulder, on their knee, on their hip, and yet our pelvis, we hear nothing.
Yeah, I know. And it's so frustrating and really, I find alarming and irresponsible when you consider how important the pelvic floor is to so many aspects of our life. The fact that people are not provided support, are not immediately referred to pelvic floor physical therapy, astounds me. And it enrages me, really. So in my app, the surgery program that I have is a whole separate piece, but there are elements that are contained within the app, from like the exercise, the recovery exercise protocol, some of the meal plans that are in there. So I tried to not just have a set of recipes for month 1, month 2, month 3, month 4. It was very specific to reducing inflammation, dealing with autoimmunity, reducing constipation, helping hormone balance. Like there's different themes in there, not just maybe somebody doesn't necessarily need it, or maybe they just don't think they need it. And now they're thinking, oh, you can eat in a way to balance hormones. I had no idea. Oh, you could eat in a way to reduce inflammation. I had no idea. So it's trying to just also set the stage for life, for wellness through the various stages that we go through, with pelvic health and pelvic fitness being a component of a bigger picture. And so within the app, I wanted it to be a place that was with you wherever you go, and you can open it up and you can choose from different types of workouts. Maybe I have workouts if you're feeling symptomatic on a day, or if you're feeling very energetic on a day. Postpartum or post-recovery, there is a kind of a retraining protocol that people go through with guidelines with regards to rest and movement and stretching and scar tissue management. That again, nobody's told us about that. And so kind of like how when we formed Bellies Inc., our big belief we had was preparing people for recovery. And I believe the same is with post-op. That being said, one thing I've realized over 18 years is we know people have waited many years to seek help. Sometimes that is because of lack of information or shame or embarrassment. And sometimes it's because they have ignored tiny little symptoms along the way because they accepted it as normal. And sometimes it's also that people are more motivated to fix a problem that exists than they are to prevent it from happening in the first place. And I only have a problem with that Sure, I don't have a problem with that, but I want people to have the information to be able to make an informed choice. And I don't think that everybody has been provided all of the information. And if they had, maybe they would have taken action sooner. Does that make sense?
Yeah, absolutely.
Yeah.
Absolutely. No, when it comes to information, it does, it gets a little mucky. Because as a professional, I have to constantly, make sure that, the information that I'm providing is evidence-based. I have to be very careful when it comes to even nutrition, even though I know that it is within my scope of practice to guide people in the best information that they can, at least use to improve their function. But, it's really a responsibility that I also have in making sure they're connected with a registered dietitian or connected with a nutritionist. So I walk a very fine line as to information. And what frustrates me the most is I'm so careful walking this line that I still have a line of people who are just not getting it soon enough. So I'm more interested now in this phase of my career in connecting people who have the information, who have done kind of their due diligence and forming these teams and communities of experts. Like you had in your app, you have Vagina Village. I want to talk about that. I'm more interested in just getting information to people faster. It's not that I did not spend all this time and education and money to do quality control on everyone out there. I'm sorry. Right now, we have the most common procedure at least in the United States. I don't know for Canada. Can't speak for Canada. You have to help me out, Kim.
Hysterectomies.
So cesarean section is our most common
cesarean section. Okay.
For us, but the second most common surgery performed on women is a hysterectomy.
Yeah.
And so right now, I can honestly say we probably have less than, I would be really generous to even say we have 10,000, pelvic health physios, here in the United States. That would be very generous to say we have 10,000. And it would be very generation to say that we even have, however many providers that are team-based towards women's health, towards, specifically those surgeries. So if we are at least averaging about 1 million cesarean sections alone in this country, what we're looking at is we have a group of people who do not have a team that's really been dedicated towards their nutrition, towards their fitness, towards their mental health recovery. Because after C-section, most often than not, they're caring for a baby. They're assuming a new role. And so I'm busy doing quality control on what? On information. I really have struggled with this, which is why I'm so happy to speak with you, because, to me, I feel like it's more of a detriment at this point to not partner, to not collaborate, and to not connect people with different sources of information as much as we possibly can before they have the procedure.
Yeah, I wholeheartedly agree. And I've always believed in a collaborative approach. And there are now more collaborative health clinics that are being formed across North America, really in Canada and in the United States. And the challenge with those, though, is they're often private. And so in Canada, we have free healthcare, but your free healthcare means you have wait lists of 1 year to 2 years to see a specialist. So a lot of people do end up paying privately because they need care sooner or want care sooner, but not everybody has that option. So they are often waiting. And during that time, there is further degradation to their mental health or to their emotional or physical. I think of all the people who are told they can't lift, they can't run, they can't jump, they can't do this because they have a prolapse or because they're waiting for surgery or because they've had a surgery. And so what is that doing to their heart health and their brain health and their bone health? And so, you know what I mean? We deserve so much more and so much better and so much sooner. That being said, what I've also recognized is, especially after COVID, people are information overloaded because of all of the Zooms and the summits and the online stuff. And everybody was racing to create online programs to support people, which is fantastic. But now it's kind of become, who do I pay attention to? There's one person over here saying this, there's another person over here. And so there's also, as like, careful what we wish for, because it's amazing. I'm glad it's out there, but now there's also there's lots of individuals doing similar work and can create some confusion for the person, even if they are starting to do their own research. So I think a collaborative team, healthcare team that has physicians, surgeons, pelvic floor physios, fitness professionals, dietitians, registered massage therapists, chiro, like all of these people, functional medicine, functional nutrition, all that kind of stuff would be great, where they can share information, patient information, so the person isn't constantly repeating their story over and over again. And there's one clinic here in Vancouver where their main thing is pregnancy and birth support, I would say. And they do something called connecting pregnancy groups, and they have that people throughout their pregnancy. And these are free for anybody in that, as part of that, like seeing a practitioner in that clinic with midwives and doctors. And they do have some pelvic floor physical therapists there as well. So everybody is allowed to come and attend these groups. It used to be in person, of course, now it's online, and they're actually continuing them online because it is created, it's easier for people. They don't have to rush around and get through traffic in the city. So we meet online similar to this, and people are given information at each week, and they have guest speakers. So I'm one of the speakers that comes in and talks about pelvic health. They have nutrition, they have postpartum recovery, they have all these things. And I love that approach. And people are taking maybe some more time to learn while they're pregnant, but we have nothing like that from a surgical perspective. So what if people who go and seek surgical guidance, what if there was this other team within that doctor, that physician's office, who was responsible for the connecting surgery group, and people came and did some drop-ins on Zoom or meeting in person, where they learn about their procedure, where they learn all of the other things and root causes and things they can be doing while they're waiting for their surgical date. So when they go through the procedure, they feel not only emotionally prepared, but physically prepared. And that, to me, when I remember, I had so much angst about my pelvic floor and about should I do surgery or not, that I know that was a contributing factor to my high blood pressure and to the other health conditions that I was experiencing. So it was like a chicken and the egg. They were all kind of, contributing to one another. So I was addressing a lot of issues with regards to my health, with pelvic health being one of it, but all the other things I was doing was helping manage those symptoms, and got me to a place where I had like a major surgery ahead of me in my pelvis, that there could be side effects. It could go wrong. It could be terrible. It could make things worse. But I felt so calm and confident going into that because of the work I did ahead of time. And I want that for everybody. I want everyone to go in feeling like I've made a really good decision for my body. I trust my doctor. I trust my body. I trust that there will be a positive outcome. I know I'm prepared for my recovery and my return to fitness, and I will be stronger as a result. So many people are lying on that table scared and afraid, and cortisol is surging through their body, and they've got inflammation, and they haven't addressed other health issues. That I think that if we can get people calmer and more informed and in a better health state with education, I just feel, I have no evidence to support this, but I just feel like we would have better outcomes.
And what you're essentially talking about is a huge component to mental health.
1000%. Pelvic health is mental health, and it's so overlooked so often. And surgery adds another layer, another source of anxiety and stress. Is it going to fail? Because we hear all the time the negatives of surgery. There's a high recurrence rate, high failure rate, so many complications. And so people are desperate to get rid of the symptoms that are holding them back, but they're so afraid of dealing with something worse. And we have to educate again, but why? Kind of like educating about pelvic health when we're younger, or menstruation. Why are we presenting it like you're going to get a period and it's going to suck and you're going to have cramps? Like, why don't we present it in a way that's positive and uplifting and hopeful, and gives people power of all the things they can do to be in control of that situation, rather than well, I don't know if you're going to want to do that because there's a high failure rate. You're not going to be able to lift anything. You're not going to be able to blah, blah, blah. And so I just feel like we need to kind of flip the conversation.
I agree. There is a question, and I want to give this the author of that question a chance to unmic and ask you directly, if you will. I believe it's Dr. Dion Middlebrooks is with us today, and so Dion, if you can unmic whenever you're able to.
Are you able to hear me?
There we go. Okay.
Awesome. Awesome. Thank you so much for providing this information. I did just have a question in regards to your app. When it was when you were talking about the recipes that you provide, how do those compare to information provided by a licensed dietitian and or a functional medicine doctor when dealing with individuals who have to undergo surgery, especially for public health related purposes, who typically may have things such as chronic pain and or hormonal issues? So how would those compare to the functional medicine, what they would provide, and or licensed dietitian?
Yeah, that's a really good question. So I myself am I'm not trained in managing hormones. I can guide people through where to seek help for it, but I don't necessarily know somebody's hormone background. Sometimes I do now that I have the menopause support training, but I don't know all of the health parameters that somebody is experiencing. So I am providing information that is the programs are actually created by licensed dietitians through a platform that they kind of build certain programs for certain populations, and I can go in and tweak based on certain needs of a person if I need to. So they're not individualized, but they are under the guidance of a licensed dietitian, not a functional. I don't believe they have a functional nutrition practitioner on their team. I believe they're all licensed dietitians. So that's where they come from. It's kind of under the guidance of them. And for the people that have shared more information with me, again, so I have now more education with regards to perimenopause and menopause, and I'm not a doctor. I cannot prescribe anything, but I have more awareness of reading lab tests and understanding hormones, and then being able to guide people to who to go see for additional testing or information or guidance. And so again, I kind of have my Vagina Village, and those are all not necessarily pelvic health practitioners, but other people who work with that population who can come in and help with the hormone testing or the prescribing or more nutrition or in-depth nutrition if somebody needs something a little bit more specialized.
Your Vagina Village, it reminds me of, there's a practitioner, I believe, in our audience, but she's created a village of kind of people that she's vetted, as well,
Awesome.
Providers that she's vetted, including dentists, midwives, doulas, cardiologists. I mean, just it reminds me of the system that we were just talking about, in terms of providing people with almost this team-based approach where they can, feel safe to be on a Zoom call like this and ask their questions and just be heard and just kind of have their fears alleviated. I think that that's really important, that you are also, pulling in other providers that are not necessarily pelvic health, but they represent a really wide range of information.
Yeah, I think it's important. And if we look again back to pregnancy and postpartum, where I began and where some of us still continue to work, there's the saying, raising a child takes a village, and some people say birth takes a village. And I think our overall health and well-being takes a village. And when we have support from family, from friends, and our healthcare team, I think that I just feel we have more robust support and options. And again, we are more informed to be able to make the choices we need to for our bodies.
Excellent. In our last few minutes together, if you had, there's so many that, pieces of advice and recommendations that we could give, but if there was one thing that you'd want women to know before scheduling their procedure, what would it be?
Well, the number one I mentioned earlier is knowing conservative options and addressing root causes. That's always number one. I think everybody should be given options and opportunities to do so, and I stress the importance of that. The next thing would be the recovery piece. So similar to postpartum, there is this 6-week green light, and we just accept it. We just accept that we get a clearance from our physician at 6 weeks postpartum or post-op, and then we are cleared to go back to regular activities. And I believe from a postpartum and a post-op perspective I do not believe that we are ready to go back to regular activities at 6 weeks postpartum. And regular activities is different for every single person. So some people will interpret a regular activity as a walk, which I think we're fine to do. Other people want to go back to maybe what they were doing before, or maybe what they weren't doing because their symptoms were holding them back. And now they're free of symptoms, which is great. But symptoms are a reminder, and symptoms are kind of that little thing that may hold us back from doing too much too soon. And so my other biggest piece of advice is be very diligent and intentional with your recovery. So have some steps in place for tissue healing, for nutrition, for rest, and for movement. And make sure that your pelvic health physical therapist is part of your recovery plan. So around 6 to 8 weeks post-op, you're seeing your pelvic floor physical therapist. Ideally, we would have planted some seeds around scar tissue management and kind of, again, that gentle movement that we're doing, the pelvic floor reconnection stuff that happens ahead of time. And then you see the pelvic floor physical therapist, they provide some more steps as to how to progress. And that we are also then taking the principles of progressive loading from fitness and not just going from 0 to 60. We need to retrain the system. We need to retrain the pelvic floor as part of our core strategy, as part of our pressure management. And that doesn't happen by 6 weeks, nor does it happen 6 weeks after that. So it's more like 6 to 12 months, maybe, before we're back to where we were. That doesn't mean we're just sitting around doing nothing. We are absolutely being active, but we need to have purpose there. We can't just blindly go. And it can be challenging because just like I was the same. After you've given birth and you've been feeling heavy, you've had aches and pains, you haven't felt yourself, and now you're just like, you're free and you feel you just want to move again. I know that, but we have to retrain the system first, then progressively load it. And it was probably about 6-ish. I'd have to look back in my Instagram, probably 6-ish months before I was adding resistance to my movement and starting to add a little bit more dynamic movement. But there are people who are back at boot camps and CrossFits at 6 to 8 weeks post-op. And I just think that's too soon personally. So I would address root causes, and I would make sure we are prepared for the recovery and have an intentional plan in place to ensure that we retrain and progressively load back to activity.
I completely agree. There is another person who wants to pick your brain a little bit, Kim.
Sure.
Feel free. I'm going to let this person come on up.
Hello, how are you?
I'm well. How are you?
I'm doing well. Thank you. Thank you for all that you do and for the time, the thoughtfulness that you put into all of it.
Thank you. You're welcome.
One thing I wanted to ask, and maybe it's really just clarify, is I know that you said that PTs, you said that you let people know that pelvic health PTs do the internal exam, but you all do more of the movement. Have you shadowed pelvic health PTs before? I might have missed that at the very beginning, because there are pelvic health PTs who may not do internals, and they do focus a lot on movement. And so I think that the differentiation may not be that. I'm not sure what it is yet, but in terms of just in the US, we do a lot with movement, not just focusing on the pelvic floor. We do the progressive, just like you were explaining. So I don't know if that's a differentiating factor, but I would want to make sure that the definition of what a pelvic health PT does is accurate so that people don't think that they are missing something because they choose a pelvic health PT over your service.
Mm-hmm. Yeah. And I would hope that they choose both as opposed to one over the other. And sometimes people only choose pelvic PT. And if they were going to choose one, a lot of time that's the one that I would recommend because they do have that internal component, which I think is so valuable. So you're right. There are lots of pelvic health PTs that do internal evaluation. Some don't do internal evaluation and only focus on the movement. I am a bit biased that I do think that internal evaluation does provide really valuable information, but I also know that there are people who it's not comfortable for them, for whatever reason in their background, that an internal is not something that they are going to go ahead and do. So working with somebody who's trained in that, but trained in other movement capacities is perfect. So the big piece is the internal evaluation. Really, it comes down to, I am not licensed to evaluate and treat internally. So if I'm working solely with somebody, I have ways that I can make some assumptions about things such as hypertonicity or incontinence or prolapse or what have you, or they can tell me symptoms, but I can't actually feel what the pelvic floor is doing. And so that's where I rely heavily on the pelvic floor PTs who can perform that. And we collaborate with conversation about, this is what I see and what I think. Do you see and feel that? But yeah, you're absolutely right. There are so many PTs who, especially people who have that sports background. And I prefer to refer to people who have that background, because I feel like there's more exploration of movement than somebody who is not as movement focused and really just does the internal evaluation and treatment.
Okay, yeah, I've not met any PTs who only do that. So even neuro, so my background is neuro. But there are PTs who worked in peds, or they may have done acute care. It may just be different training. But also, so the second part of my question is about the other movement strategies that you have. Can you tell us a little bit about it? I know you were saying that you have some other movement strategies, and I've not personally seen or used your app, so I apologize.
Sure. Yeah, so a lot of it will be very familiar for PTs who have done work with, say, Julie Wiebe, or who understand the piston approach. So I took her course very early on, and even so, she allowed me, even not being a PT, to come and take her course. This is probably 15 or so years ago, as the piston was sort of emerging, and that became a kind of a critical component. So with regards to cueing the breath and the pelvic floor. And I also worked with a surgeon by the name of Dr. Bruce Crawford, who's out of Reno, Nevada, pardon me. And he used, designed a program called Pilates, which is pelvic floor Pilates. And so working with him and understanding his research and actually being hooked up and going through his lab with him, I taught with him. I taught his course with him for 2 years. So embracing some of the strategies there. And then another big one is hypopressives, which some PTs are trained in and some are not. And so it's bringing in the principles of fitness with my knowledge of pelvic health, with what I've gained from working with Dr. Bruce Crawford. And also I did have a pelvic PT as a business partner for 10 years. It was funny because the three of us in Bellies Inc., one of which was a pelvic PT, her name is Julia DePaulo, and she evaluated our pelvic floors all the time, and we would test things on one another to see what happens when we do this, what happens when and that was a lot of the creation of what we were doing. And obviously that's N of one person doing that, but how, when we're creating an online program for the masses, how can we make this the most accessible as possible to the individual approach? Working with a PT is of course gold standard, but we needed something that was at least going to give other options to people who geographically, financially, or for whatever other reason cannot or will not go see the in-person.
And that's that's where I am right now, is that we do not have enough people who can help people understand that at 6 weeks you cannot start running. You can't go back to the 5K. And so that's kind of, that's the purpose of this discussion, is that people don't have the information they need, either because there's not a pelvic PT, accessible to them. They can't afford cash-based services, which, we struggle with a lot in this country, being able to be reimbursed for our time as therapists, but then also realizing there's a lot of overwhelm. There's a lot of waiting that people are having to experience. And then also just the information that they're given, is it going to be this overwhelm of information from this coach, from this trainer, from this consultant? Is it the right information? Is it what they need? We're constantly struggling with that. And to me, it's time to collaborate. It's time to even give them maybe doula support for after pelvic surgery, not just after birth, so that they don't feel like they have to go, get up and clean their house and cook and do all of these things that, society tells us we need to get back to as soon as possible. There's a few other comments and questions. I believe fire away. Yes. So absolutely. Dr. Sylvester wants to thank you for your time. Yes. And I think Dr. Middlebrooks wanted to ask just one more question. Feel free to unmic.
Thank you. Yes, I did at least want to make sure before I start that I do thank you for providing information, like you said, for the masses, for the majority. I do have a question in regards to that because the issue that I commonly run into, just to give you my background, I am a physical therapist. I'm a public health physical therapist. I also specialize in other things. I have a huge sports background, various certifications in that, but I still run into the issue of when patients come see me because they've been working with either a vagina coach or someone who is a personal trainer who indicates that they do Pilates for the pelvic floor, that when they come to me and I'm saying, well, we have to modify or change certain things, at that point, because they already have the rapport built with the other individual, despite me being licensed, they're saying, well, I trust them. I completely understand that. And at that point, when I'm trying to reach out to the personal trainer and or whoever they're working with, trying to emphasize, okay, this is the change I'm wanting to make and this is why, so I can have that collaborative based care. No matter what approach I take, I'm often received pretty much with bombardment of resistance. And it's not that I'm trying to put anyone in their place, as some people have tried to take it as, or it's not that I'm trying to discourage them from working with another individual. It's more so that I'm trying to make modifications so that way I can address the specific issue. For instance, I fit for pessaries, and that's something I commonly see when I'm fitting patients for pessaries. I'm saying, okay, we're going to this pessary itself. Now we have to, in addition to this pessary, I need for you to work on these different management techniques. But the moment the trainer hears pessary, they hear, great, they're good to go. That's not the case. So what is the best way so we can better have that collaborative approach? So that way the trainers realize that I'm a physical therapist. I have various certifications in sports and also personal training, conditioning, those different activities, and that I also want to what's best for the client or patient. And I'm not trying to deter them from working with them. I actually prefer for me to be able to work with them and say, yeah, great, you've done this with me. It's time for me to pass you along. But I can't often get to that phase because of the resistance that I'm met with.
Yeah. And that's so unfortunate. And I know that it is. So on the flip side of that, initially, when I first started working with Julia, who I mentioned, she's a pelvic floor physical therapist. She recently moved to Texas, actually. So she is Canadian. She's from Toronto. That's where she practiced for many years. She's now living, and I don't know if she's practicing yet. She had to go and recertify down in the States, but she is in Texas now. So when we first started working together, she was very hesitant in that we were these fitness professionals wanting to bring this conversation to the world of fitness, because she said, well, when I release my patients to work with personal trainers and fitness, they will come back to me because they've used poor strategies, or, they've kind of undone the work that I have done. And so she was hesitant, but also we need this collaborative approach. So when we created our certification, it was to bridge that gap between fitness and physical therapy. And so I'm actually surprised, to be honest, that that trainer is hesitant, because there are now, we're not the only certification. There are plenty of women's health certifications. Brianna Battles has one. The Girls Gone Strong is a very popular one as well. So there's the information is getting out there, and I know they also promote that collaborative approach. So I'm surprised at the resistance of that person. And I guess I'm hoping that that's a one-off and that it's not something that you are, but I'm kind of getting the sense of maybe it is something that you have experienced with other people as well. But I would educate the client on the way that you believe that collaboration should happen. Explain your beliefs, like why you are making the choices you are and what it's like, the purpose that it's serving. And then, at the end of the day, it is informed choice for that person. If they choose to pay more attention to the trainer, that's unfortunate, but that is their choice. And I just hope that with more and more people taking my course, Brianna's course, Molly's course, that there will be less and less of that, because we do need that collaboration there. So I would just do your best to explain to that person the reasons behind what you're doing. Explain that potentially what they are doing now has contributed to where they are, and if continued effort might lead them back here. And then at the end of the day, it's their choice.
I agree. I think that this really, I mean, brings us kind of full circle on this talk tonight, is that at the end of the day, we know we do not have enough pelvic health therapists. This is where we are. We have more surgeries than we can handle that are being done. Just with pelvic health alone, that are performed on women, and they're not given information that calms down their nervous system beforehand or prepares them for recovery.
Mhm.
And so to me, collaboration is the future. Team-based care is the future. And you've been a part of this movement so long, and your experience is just so. I follow Julia's work, and I'm just such a fan of.
She's
of
hard
what
to find on social media, but
that's a good
but,
thing.
yeah.
Mental health first, yeah.
Yeah.
Mental health first. So thank you everyone who came tonight, who joined us live. Who was able to engage with Kim. And Kim, thank you so much for your time. Where can people find you? Give us all of your information, about 1 minute or less.
Yeah, well, thank you everybody who joined. Thank you for your questions, and thank you very much for the work that you do. I am the biggest supporter of pelvic health physio, and I will continue to preach and yell from the rooftops that we all deserve to see pelvic floor physio paid for by the government every single year. My basically, put Vagina Coach into Google and you'll find vaginacoach.com, my website, and all the social media platforms. I share a lot of free content on my YouTube, also on Instagram. I'm also on TikTok. Reluctantly, but there's resources there for people to find. And then of course my Buff Muff app, and I do have some programs such as Pelvic Surgery Success that is designed to take people from the kind of the contemplation to the getting back to fitness and movement, with support and guidance from myself. So thank you very much for having me, and for all the work that you do in helping move this need forward.
Excellent. So Buff Muff app, Vagina Coach, that'll lead us all to the app, to Pelvic Surgery Success, the training and coaching program that women can go through before they schedule their surgery, as well as your book that's on Amazon, Your Pelvic Floor Practical Guide to Solving Your Most Intimate Problems.
Thank you so much.
Awesome. Thank you.